be discussing about a new topic that is pain. So, by definition, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue loss or damage described in terms of such damage. Now, etiology and precipitation factors associated with pain: surgical or accidental trauma inflammation, musculoskeletal disorders such as SPAS, immunodeficiency syndrome, neuropathies, excessive pressure, vascular disorders, example is systemic lupus erythematosus, and visceral disorders such as myocardial infarction will precipitate pain. Now, the types of pain, the various types of pain could be sharp shooting, which is seen in irreversible pulpitis, lancinating or stabbing sort of pain, which is seen in trigeminal neuralgia, throbbing or dull pain, which is associated with neurovascular headache or periapical abscess, electric shock-like pain, which is seen in cases with neuralgias. Burning pain is associated with burning mouth syndrome and in conditions associated with neuropathies. Goning pain, which is associated with periodontal pockets. Cutaneous pain is seen in conditions associated with skin. Somatic pain is seen in conditions associated with deeper connective tissue such as muscle, tendon, joints. Visceral pain is seen associated with internal organs, and deferred pain is seen in association with MI, where the pain is referred to the left hand and the back of the shoulder on the left side, and visceral surgery, such as in cases of cholelithiasis, where this pain is referred to the ipsilateral shoulder. On the basis of duration, pain can be classified as acute pain or chronic pain. In acute pain, the pain has existed from a few seconds to a month, and in chronic pain, the pain has lasted for over a month. Now, there are different theories of pain. First one is the specific receptor theory, in which it is stated that there are specific receptors or specialized receptors which, when receive the pain stimulus, will transfer the stimulus to the brain, where the stimulus will be interpreted as pain as such. So for different sensations, specialized receptors are present in the body. The few are Meissner's corpuscle receptors, which are responsible for the sensation of touch. Then Ruffini end organ receptors are responsible for the sensation of warmth. Crossi end bulb receptors are responsible for the sensation of cold, and nociceptors, that is in concern with pain, is associated with taking the sensation of pain to the brain. Then pattern theory. This theory states that different sensations, that is one, two or more sensations, they when they combine together in a pattern or in a way, that the resultant stimulus will be interpreted as pain. So according to pattern theory, it states that two sensations, for example, say the sensation of pressure and the sensation of warmth, when applied simultaneously on one part of the body in a ratio or in threshold, that will be interpreted as pain. So pain, pressure, and touch, the warmth or the warm sensation can combine together and cause the sensation of pain, or the sensation of cold to an extreme extent will also result in sensation of pain. Then the gate control theory. It was given by Wall Milzak, and according to this theory, The pain sensation is carried to the brain by two fibers. One is the fast fiber, that is alpha delta fibers, and the other one is carried by the C fibers. So the theory states that there is a negative feedback phenomena which occurs, that when the pain is or any stimulus is carried by fast fibers, it will shut down the fibers which the slow fibers, that is the C fibers, which are carrying the pain. Then there is labeled theory, then there is intensive theory and chemical theories. Intensive theory, it says that any touch, when it exceeds a certain level of pressure, it will cause pain. And chemical theory, it states that the pain is carried by uh, or perceived due to certain chemicals or accumulation of certain chemicals in the body, such as GABA, endorphins, and substance P. So when these substances are accumulated in the body for a certain period of time, they will cause the sensation of pain. Now coming to orofacial pain, the etiological classification can be divided into local cause or the pain along the nerve trunk and referred pain. Amongst the local causes, TMJ and associated structures can cause pain in orofacial region. Muscles of mastication can cause pain in orofacial region. Oral mucosal diseases, pathological changes in teeth and jaw. Salivary gland diseases will cause pain in orofacial region, diseases of blood vessels and lymph nodes. Amongst the pain along the nerve trunk and central pathway, trigeminal neuralgia, glossopharyngeal neuralgia, and atypical facial palsy and migraine are the causes for which will result in orofacial pain. Apart from that, referred pain can be caused by the cervical spondylitis. The pain of cervical spondylitis will be referred to certain region in orofacial region. Angina pectoris, oropharyngeal diseases will cause pain in orofacial region. So this was the first part of pain. In the next video, we will discuss the pathway of the pain and the management. So I hope this video was enlightening and it was of some help to you. Until we meet next, thank you and bye-bye.